Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Sidise. Glad you could be with us for the show. If you're watching us live, you can be watching us on YouTube, LinkedIn, Facebook, X, any of those formats. We're coming to you live every Saturday at 9 a.m. Central Time. If this is your first time joining us, be sure to check out our website at uronurse.com. Best place to learn more about the show, visit some of our favorite sponsors for the show, and also the best place to go to see all of our past episodes. We got a bunch of them out there. Also, due to popular demand, we do have an audio podcast that comes out sometime later today on all your favorite podcasting apps like Apple Podcasts, Spotify, iHeart, Amazon Music, and YouTube Music. So you can listen in your car. Beep, beep. Hey, we got a great show for you this week. This week, we're going to be doing one of our credit hours with our association with my CME. And it's going to be on something I really thought was a great subject to talk about, and that's cleaning and disinfecting of equipment. I think sometimes if you're new to urology, you may not know all of the different classifications of equipment and how it should be processed, to keep patients safe. That's important. And even if you've been doing it for a while, sometimes it's a good reminder just to make sure you're doing everything properly. So I think this is a great one. It's a great time to look at this so that we can kind of keep this up. If you got new employees, this is the perfect tape to have them watch. Now, as I said, it's going to be about an hour long. So I'm not going to take any questions, no experts to answer questions at the end of the show. But I wanted to keep in some respect for your time. So we're going to run the show and then we'll talk about next week's show, and that'll be it. So let's get started with the show.
Hello, my name is Dr. Laurel Robinson, and I am happy to have the opportunity to talk with you today regarding the importance of cleaning and disinfection of reusable medical equipment. The use of items and devices that are not disposable but need to be reused is part of care that is provided in all settings. This content is sponsored by Project First Line, which is a national collaborative led by the U.S. Centers for Disease Control and Prevention to provide infection control training and education to frontline healthcare workers and public health personnel. The Kentucky Infection Prevention Training Center is proud to partner with the Kentucky Department of Public Health and Project First Line. Okay, so our objectives here for our session will be: Number 1, define the role reusable medical equipment may have in pathogen transmission. Number 2, review types of low and intermediate level disinfectants used in healthcare settings. Number 3, describe the Spalding classification as a guide for use of cleaning and disinfection approaches relevant to reusable medical equipment. And number 4, apply knowledge in practice to minimize risk associated with pathogen transmission and reusable medical equipment. As we move through these objectives, we will structure the information into 3 sections. First, we will provide basic information that establishes background concepts important when outlining the why behind the content. This is the pre-brief section. The second section will contain simulation examples. These examples seek to demonstrate application of the content and visually demonstrate the reason it is important for healthcare workers to understand the rationale or the why behind infection prevention measures. The last section is the debrief. During this last section, participants are guided through discussions that dive deeper into the knowledge, application challenges, and barriers, and help participants take steps enabling them to put knowledge into action that is scalable and transferable to various situations and care settings. To set the stage for this discussion, let's listen to some information provided by Dr. Abby Carlson from the CDC, describing why cleaning and disinfection matter in healthcare.
Welcome back, everyone, to Inside Infection Control, our video blog here at CDC's Project First Line. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC. And it's wonderful to have you back with us today. In an earlier episode, we had talked about cleaning and disinfection and the difference between the two. In general, cleaning removes dirt and gunk and removes and sometimes kills some germs. But disinfection makes sure that as many germs as possible are destroyed or killed. Today we're going to talk just a little bit more about why cleaning and disinfection are so important in healthcare. Not just for stopping the spread of SARS-CoV-2, that virus that causes COVID-19, but for stopping the spread of lots of different germs and infections. It's common sense that cleaning is important to keep infections from spreading in healthcare settings. Cleaning and getting rid of dust and dirt and body fluids keeps germs away from people. Disinfection, when you think about it, is also common sense too. Killing germs definitely keeps them away from people and therefore keeps people from getting sick. Even though it's common sense, though, it's important to think through all the reasons why we're so careful about keeping an environment clean. Now, you probably clean and disinfect when you're at home. You clean your windows, you wash your dog, you might even disinfect some parts of your kitchen or your bathroom. But cleaning and disinfection in healthcare is a bit different. Why is that? When we're at home and we're healthy, our bodies have a lot of built-in ways to protect us from infection, including things like our immune system or even our skin, which is a very important part of our immune system as a whole. But in healthcare, we have a lot of patients who are ill and weak, and germs are more likely to cause problems in these patients because their immune defenses might not be the same as somebody who's healthy and living at home. With some patients, you can see how they might be vulnerable to infections if they have burns or wounds, for example, or if they're having a procedure done where germs can get under the skin, like having an IV put in or a catheter. But a lot of patients have things going on that you can't really see, like if their immune system is weak because of the medication in their cancer treatment. So it's incredibly important to have the environment free of germs, especially in places where they can pose risks to patients, and to us, and to our coworkers. So, for example, when a patient leaves a room or is discharged, right before a new patient goes into that room, it should be cleaned and disinfected to make sure that the next patient is protected from the previous patient's germs. We also clean and disinfect things that get touched a lot, like door handles, keyboards at the nurse's station, light switches. We call all of these high-touch surfaces, and they need more frequent cleaning and disinfection because all of the hands that get on them. Because we know that if germs get on our hands, then they can get all over the place, and that can make people sick. We also clean and disinfect things that may not get touched or shared as often, but that we know tend to be dirty and have a lot of germs on them, things like a toilet seat or a patient's mattress. There's even more reason that killing germs is so important. A lot of the germs that we're seeing in healthcare are unfortunately becoming more resistant to antibiotics. That means if somebody gets sick with those germs, the antibiotics, those medicines that we use to treat them, might be less likely to work and less likely to help that person get better. There have been outbreaks before where people have gotten sick from these germs in healthcare, and antibiotics.
What is reusable medical equipment? When care is provided, healthcare workers use a variety of supplies and equipment. Some items are disposable, such as dressing supplies, personal hygiene items, injection supplies, pop-up disinfectant wipes, and some pieces of personal protective equipment. Those items are used once, then disposed of. However, many items used in healthcare are not disposable. They are needed to be used on multiple patients, and sometimes items are moved quickly from patient to patient. Dr. Carlson just talked about these situations and the risks associated with those devices. The reality is that patient care in almost every setting involves the use of equipment that is not disposable or designed to be used only once with a single patient. Examples of items that are reused include blood pressure machines, glucose meters, electronic thermometers, infusion pumps, and patient furniture. Each of those pieces of reusable equipment have a different use and may have different ways of being disinfected. Nevertheless, it is important that each healthcare worker recognize that anything that is used as part of the care or contact with the patient must be cleaned and disinfected before being used on another. Let's start by reviewing some terms. Cleaning is the removal of visible soil. This includes organic materials such as body fluid as well as inorganic matter such as dust. All objects and surfaces in healthcare settings must be regularly cleaned to remove these materials. Cleaning is accomplished either manually by an individual wiping the surface or items, or it can be done mechanically. Examples of mechanical cleaning include automatic floor scrubbers used by environmental service workers and instrument washers used in instrument decontamination areas. Cleaning is done using detergents mixed with water or enzymatic products also mixed with water. Detergents often have an agent that helps suspend organic and inorganic materials so they can be wiped away. Enzymatic products help begin a process that dissolves the material so it can also be wiped away. It is important that cleaning of every item be done prior to disinfection because material left on the surfaces of reusable items may minimize the effectiveness of the disinfectant products. So, the point to remember is that removal of organic or inorganic material should always be done before disinfection. Once the item has been cleaned, it is then important to eliminate germs that may be on that item or surface. Disinfection is a process that eliminates many germs capable of causing illness, but not all of them. Disinfectants, also called germicides, are chemicals that are able to kill many of those germs. Bacterial spores are microorganisms that are more difficult to kill and require special types of germicides or even sterilization to kill them. The Environmental Protection Agency, EPA, is the United States government agency that regulates germicides and uses information from germicide manufacturers to determine what is on the product labels. In healthcare, we use germicides able to kill the germs commonly seen in healthcare settings. These are often different from the germs we have in our homes. Therefore, the germicides used in healthcare are of a higher grade than those used in non-healthcare settings. The EPA maintains lists of germicides suitable for use in healthcare settings, and these are often called healthcare grade or hospital-approved germicides. They are not restricted for use in hospitals, but are appropriate for use in all healthcare settings. During the COVID-19 pandemic, the EPA provided an updated list of germicides effective against emerging germs. This list is called List N and can be found on the EPA website along with all EPA-registered disinfectants suitable for use in healthcare settings. When approaching a process for cleaning and disinfection of reusable medical equipment, it is important to have guiding documents that can be used for training and for evaluating practices and processes. Written policies and procedures should include information about the germicide and instructions for use. This information is available from the germicide manufacturer. Using policies and procedures that include how to use and when to use help train healthcare personnel so they are familiar with the germicide being used and how to use it on particular reusable items. Those using disinfectants should be aware of the appropriate product, how to dilute or mix it, and how to apply it to the surface of the item. Individuals responsible for cleaning and disinfecting reusable items must be aware of the need to clean before disinfecting. Then use the right disinfectant and let it sit undisturbed for the contact time noted on the product label. In addition, proper personal protective equipment, such as gloves, should be worn when applying the disinfectant to the item. If germicides are mixed, the addition of water to the disinfectant concentrate may result in a splash, so the individual mixing the germicide should be prepared to put on eye protection during that process. Some disinfectants may be applied using a spraying device. Some of those devices may require additional protective equipment, including respiratory protection. Once we know the basics, how do we apply this knowledge regarding selection and use of the appropriate disinfectant and disinfectant practices? Well, first, we need to have written policies and procedures that outline when to use particular germicides and how to use them. To ensure that everyone is trained consistently, this should be clearly outlined. Then those policies and procedures aligned with performance monitoring. For example, if a germicide requires a contact time of 3 minutes, how can the person performing disinfection know that? Do they understand that the 3-minute contact time allows the germicides to work undisturbed? If the germicide is applied, then the surface is wiped again, disturbing that germicide, then the disinfecting effect may be reduced. This is why it is important that those disinfecting equipment be aware of the importance of their job. If pop-up wipes are used, they must be wet so they are able to transfer that wet germicide to the surface of the item being disinfected. Therefore, training and policy should include specific information regarding the importance of keeping containers closed so evaporation is prevented. It is important to understand the basics so the person performing equipment disinfecting knows why their work is important and why it is important to follow the steps outlined in these policies. It is critical that individuals developing policies and procedures have specific knowledge of germicides and how they work. Spalding classification. We have talked about germicides and that they may differ. So let's now talk about the framework that guides decision-making when we are developing procedures to clean and disinfect reusable medical equipment that may have different purposes for patient care. The framework that is accepted and supported by the Centers for Disease Control and Prevention, the CDC, and the Environmental Protection Agency, the EPA, is the Spalding classification. This classification outlines the type of equipment and its reasons for use, then determines the risk that the device presents to the patient. The cleaning and disinfection methods are determined by the risk posed by the piece of reusable medical equipment and its intended use. For example, let's talk about the lowest level of risk. First, remember that there is never a situation where there is no risk present. That is why we always clean and disinfect items that will come in contact with a patient or be touched by a healthcare worker who then touches the patient. Remember the way germs can be transferred from equipment to patients, so proper cleaning and disinfection helps prevent that transfer opportunity. According to Spalding, there are 3 levels of patient risk involved in medical devices and equipment. Non-critical risk involves devices or equipment that only come in contact with healthy skin of the patient. Examples include stethoscopes, electronic thermometers, blood pressure cuffs, patient furniture, ultrasound probes used for scanning, and glucose meters. It is important to note that when cleaning and disinfecting glucose meters, we are focused on the actual device that reads this test strip and not the lancing device used to pierce the skin. Those lancing devices are single patient use and should never be shared. The lancet, or finger sticking device, is a single use and disposed of after each skin pierce. This is an example as to why it is vital to know the device and the why behind its use and its risk to the patient. This knowledge drives correct decision-making. For those non-critical items, a hospital-grade, low-level disinfectant or an intermediate-level disinfectant product should be used. Some devices will make direct contact with mucous membranes, such as the throat or the vaginal canal. Examples include laryngoscope blades and various types of scopes. These devices represented a greater patient risk and must be cleaned and disinfected to a higher level. This level of risk is called semi-critical, and high-level disinfection is needed. This type of disinfection, high-level disinfection, cannot be done with the traditional wipe approach. Specific products and procedures are needed for high-level disinfectant use. Often devices needing high-level disinfection are taken to a particular department or place within the healthcare facility so they can be properly disinfected. Remember that you cannot always tell by looking at a piece of reusable equipment and determine its disinfection need. This is determined by the purpose and use of the device. When the device use is deemed as critical, it means that use of the device involves contact with sterile tissue, including contact with the bloodstream. Examples include surgical instruments, needles or catheters inserted into the bloodstream, or ultrasound probes used for real-time vascular access guidance. Often, these types of equipment are used in specialty areas, but not always. These types of devices may be used by individuals with special skills and expertise, and often in departments such as the operating room or interventional radiology. These devices must be properly cleaned and disinfected in ways so they are ready for use, then properly disinfected so they can be ready for their intended use in the care of another patient. This requires a consistent approach where everyone involved in the care of the equipment understands what needs to be done for patient safety. We mentioned low-level, intermediate, and high-level disinfectants used in healthcare, so let's look at some of those examples. There are 5 commonly used types of disinfectants in healthcare. These include quaternary ammonium compounds, the most common low-level disinfectant used in many healthcare settings, but alcohol can be added to the quaternary product and provide an intermediate level disinfectant. Hypochlorites, intermediate level disinfectants which are able to kill bacterial spores, are also called sporicidal agents. Hydrogen peroxide, another intermediate level disinfectant, also a sporicidal agent. Example: peracetic acid, another intermediate level disinfectant with a sporicidal agent that is used less frequently, and phenolics, an intermediate level disinfectant used less frequently in healthcare. Chemical sterilants such as glutaraldehyde should not be used as an environmental disinfectant. Now, let's look at these disinfectants a little more closely. This table provides an overview of the most commonly used disinfectants in healthcare settings. Those disinfectants should be able to address the most common germs in healthcare that are associated with infection. In addition, facilities need germicides able to address bloodborne pathogens such as hepatitis and HIV. Not all germicides in the facility must be able to kill bloodborne pathogens, but a product with that capability must be available for use. Other capabilities, including the ability to kill spores associated with infections such as Clostridioides difficile or C. diff, should be available. Consequently, selection of the right disinfectant for the right purpose is a critical component when ensuring cleaning and disinfection of equipment that may move from patient to patient. Quaternary ammonium products have been one type of disinfectant widely used in healthcare. Most have a detergent base, so they clean and disinfect in a one-step process. They are broadly compatible with hard surfaces, but there have been ongoing concerns with absorption by cotton products. This is one reason cotton mops and cloths are not generally used with these products, as their use may reduce the application of the disinfecting agent on the surface. Quaternary ammoniums, or quats for short, usually have a contact time of 3 to 10 minutes. Many of these products are also available in pop-up wipes. There is another group of quats that have been combined with alcohol. With the addition of alcohol, these disinfectants are able to effectively kill a broader group of germs, including hepatitis and HIV, bloodborne pathogens. This broader ability enables these disinfectants to also kill Mycobacterium tuberculosis, or MTB. This does not mean that patients with tuberculosis need this particular germicide to be used in their rooms. Instead, MTB is used as a surrogate, demonstrating an ability to kill organisms, specifically bloodborne pathogens. With this ability, these germicides gain what is known as TB kill claim. Quats with alcohol do not contain a detergent, so pre-cleaning must be done to remove any organic matter such as blood or other body fluids to enable the germicide to effectively work. These disinfectants are intermediate level disinfectants, but are not able to kill spores. Many of these products are also available in pop-up wipes. Sodium hydrochloride solutions are increasingly used in healthcare settings due to their fast action and their ability to kill spores when diluted correctly. Organic matter may result in inactivation, so cleaning of organic material before contact with the hypochlorite solution is important. Vapors may cause respiratory irritation, so these products should be used in well-ventilated areas. Also available as pop-up wipes, sodium hypochlorite, or bleach, is a chlorine disinfectant, so contact with clothing and fabrics may result in discoloration. Phenolics are one of the earlier types of disinfectants but are not used as frequently in healthcare settings. Their use may result in a residue that may be harsh on surfaces and may be dangerous for use in maternal-child areas if not properly rinsed after application. Accelerated hydrogen peroxide is an intermediate-level disinfectant that has rapidly gained use in healthcare settings. It is a one-step cleaning and disinfectant but is not sporicidal. Peracetic acid disinfectants are intermediate-level products, but they are also sporicidal. However, they have a strong vinegar odor that may be offensive to some users. They are also corrosive to some metals and may lose stability when diluted. Here is another look at these germicides, comparing attributes important for those disinfecting reusable equipment. Contact time is the amount of time the product should come in contact with the surface. An adequate amount of the disinfectant must be applied to the surface, then left undisturbed. Do not rinse away the disinfectant unless there are specific instructions to do so. You can see from the various contact times that a desirable product is one with a lower contact time. Protecting the user is an essential component of safe germicide use. Gloves should be worn to prevent hand contact of germicides, primarily due to skin irritation potentials. Other personal protective equipment, such as masks or face shields, are not generally indicated unless there is an opportunity for splash or sprays during dilution or during use. How the germicide smells may impact some users. Germicides that have an objectionable odor may be used or diluted inappropriately based upon the needs or perceptions of the user. Some users may equate a bad smell with a personal health hazard, and that is not always true. Keeping that in mind during product selection may prevent future problems with use. Surface compatibility is important, primarily if the item being cleaned and disinfected is porous. That is why some disinfectants are a better choice than others if the item being disinfected is made of fabric. As mentioned earlier, the presence of organic matter such as blood or body fluids may inactivate the germicide. Those germicides must be used after the surface has been pre-cleaned. This is a reason why products that are one-step germicides may be ideal. These products contain the detergent needed for cleaning and the disinfectant needed for disinfection, all in one product, so pre-cleaning is not necessary. You can see that selecting a single best product to use in all healthcare situations may not be possible. Individuals responsible for cleaning and disinfection of reusable medical equipment should have the right product for the right use readily available for them. Training should be provided so users understand the importance of proper cleaning and disinfection practices. We have mentioned contact time and that it is an important component of proper cleaning and disinfection practice. Contact time may also be known as dwell time. This is the amount of time that germicide needs to come into contact with the surface in order to complete the disinfection process. There are several things that need to happen in order to address this contact time. First, the surface must be clean and then must be exposed to enough of the disinfectant. If using a traditional bucket and cloth method of cleaning and disinfection, the cloth used to apply the germicide must be sufficiently wet so the entire surface comes into contact with the liquid germicide. The same goes if a pop-up wipe is used. A dry wipe or a dry cloth will not enable sufficient surface disinfection. If a spray is used, the entire surface must be sprayed so the germicide is applied to its entirety. Spray bottles of germicide may apply very little of the product and thereby provide reduced opportunity for surface disinfection. Likewise, if pop-up wipe containers are left open and the germicide evaporates, the wipes may not be wet enough and unable to apply proper amounts of the disinfectant. Also, a pop-up wipe will be limited in the area it is able to disinfect. A single wipe will likely not be sufficient to clean and disinfect an entire piece of equipment or furniture. Once the germicide has been applied to the surface must then be allowed to dry undisturbed. The germicide must not be wiped again with a dry cloth in order to remove existing germicide. Surfaces should also not be rinsed after disinfection unless specific products such as phenolics are used. Most germicide contact times are 1 to 3 minutes, but some require a longer contact time. The length of time the surface stays wet from the germicide can be impacted by a number of factors, including temperature of the environment and airflow. Remember, the goal of disinfection is not sterilization. Instead, the goal is to sufficiently reduce the number of pathogenic microorganisms on the piece of equipment so opportunity for transmission of those germs to another patient is minimized. Now, let's take some of what we have learned and begin to apply as we look at some simulated situations. As you watch this short video, look at the way the healthcare worker is interacting with the environment and the patient. See how surfaces become dirty, representing opportunities for contamination. After the healthcare worker interacts with the patient in the room, notice opportunities for movement of germs between the healthcare worker, surfaces and equipment in the room, and the patient. Once the lights go off, some of these germs make themselves known through fluorescence, and we are able to begin to see the importance of disinfection. What infection prevention breaches did you identify? You could tell this healthcare worker was moving quickly. Did she clean her hands? We are assuming that all of the gloves in that glove box are free from germs. When we enter a room without first cleaning our hands, if we go immediately to the glove box, you can see that we set a potential for germ transmission through items we all may use as part of patient care. What actions should the healthcare worker have taken to prevent surface and equipment contamination? Clean hands go a long way in preventing surface and equipment contamination. But we cannot see microorganisms and therefore cannot always judge what has been contaminated and what has not. This is one reason why we clean our hands between patients and whenever we move from a dirty task to a clean task during individual patient care. The needs of the patient always come first, so you can see why it is perfectly acceptable for this healthcare worker to move back and forth between the patient and some of their equipment. The key thing to consider is that the equipment must not be allowed to harbor microorganisms that may move from patient to patient or healthcare worker to patient. Cleaning and disinfection of equipment and surfaces between patients and hand cleaning practices are vital patient safety activities. What are the risks you can anticipate impacting patient safety? What if other healthcare workers enter this patient environment? Without proper hand cleaning, they may bring new organisms into this patient's room. They may touch that infusion pump and help populate new germs on the surface. Someone touching that surface may then be able to transfer those new germs to this patient or to other surfaces in the room. What pieces of reusable medical equipment will need to be cleaned and disinfected before use with another patient? Patient furniture, the infusion pump, the ventilator. Which of these items may have come into contact with blood or body fluids? Perhaps all of them, so our disinfectant must be able to clean and disinfect. The product must be able to kill bloodborne pathogens. Think about other things you observed and consider how to best address them for a safer patient experience. Project FirstLine has developed some useful infographics that can be helpful in delivering some very simple messages. The infographic on the left points out that healthcare workers touch many different surfaces during a single patient interaction. All of these surfaces need to be cleaned and disinfected regularly in between patients. The infographic on the right is a reminder that healthcare workers must properly care for their skin. Dry and cracked skin may harbor germs, and those organisms can be transferred to patients and surfaces. Wear gloves when disinfecting surfaces and equipment to prevent the drying effects of those products on unprotected skin. Seek assistance from employee or occupational health if the healthcare worker experiences problems with their skin. The employee health professionals may have some ideas for resolution. Here are two more Project FirstLine resources. The one on the top left shows environmental cleaning and disinfection is an important way to prevent germs from spreading from patient to patient and between healthcare workers, patients, and their care environment. The one on the right reminds us that germs are everywhere. They live on surfaces and devices used in the healthcare environment. Reducing the risk of transmitting those germs depends on cleaning and disinfection of the environment, reusable medical equipment, and consistent performance of hand cleaning. Our key takeaway messages from this first simulation experience helps address the question as to why environmental contamination is an infection risk. As we provide care, think about what opportunities for germ transmission were evident in the video. Do you see similar opportunities during your care activities? What were the most striking learning points for you? Think about how you may take this information and make changes in your own practice. Remember, when patients and healthcare personnel interact with the environment, surfaces become opportunities for contamination. Contaminated surfaces that are touched by the hands of healthcare personnel and patients allow opportunities for movement of germs from surfaces to hands and from hands to surfaces. Reusable medical equipment can serve as a reservoir for germs and must be part of a consistent and reliable environmental disinfection process. Equipment that may be used as part of care with one patient must be cleaned and disinfected before moving to another patient for use. If not properly cleaned and disinfected, the reusable medical equipment may serve as a vehicle for germ transmission. And germs cannot be seen, so standardized and sustained practices must be part of a patient safety approach. We talked about some of the attributes of germicides and how that information is visually available on the product label. Think for a moment regarding information that is important when using a germicide. What are 5 important pieces of information? Well, there are more than 5, but think of those attributes that make a difference when you are thinking about the use of germicide for cleaning and disinfection. Some questions that you may consider: is the germicide effective for the purpose? Does the germicide work in the presence of organic material? If I need to clean blood or other body fluids from the item before disinfection, is the germicide I am using effective for that purpose? What if I am disinfecting an item used as part of care with a patient who is experiencing a C. diff infection? Is that product sporicidal and able to kill the C. diff spores? Does the germicide provide cleaning and disinfection as a one-step process? Does the germicide have a detergent and a disinfectant in the same product, or do I need to clean first using one product, then disinfect using another? What is the contact time? Am I able to ensure that the surface I'm disinfecting will be able to be untouched after I apply a sufficient amount of germicide? Is my cloth sufficiently wet with the germicide so I can apply enough product? Is the germicide safe for me to use? Do I need to wear respiratory protection when using this germicide? If there is a spill, will it be safe for me to clean? Is additional ventilation required if I use this product? Do I need to mix the germicide, or is it available for me to use in a ready-to-use format such as a wipe? Environmental cleaning and disinfection is everyone's job. Although environmental services personnel are the experts, all healthcare personnel should be aware of the need to clean and disinfect items that they may take from person to person. Having the disinfectant readily available helps make sure that items such as blood glucose meters, blood pressure cuffs, electronic thermometers, and other items that may be shared amongst patients during a typical day have been properly cleaned and disinfected. Think about other attributes or pieces of information you may want to know about germicides used in your settings to clean and disinfect reusable medical equipment. As you think about these product attributes, remember that many of the pieces of information you need will be available on the product label. Using this graphic from Project Firstline, find some of those attributes. Looking on the left side of that graphic showing the disinfectant label, find the active ingredients. Look at the indications for use and the contact time. On the right side of the label, you can see information regarding special precautions such as personal protective equipment needs and how to properly store and dispose of the chemical. Other information is available on the data safety sheet and the master label. Both of these are available from the manufacturer and the EPA. Your facility should maintain copies of these documents, usually in the Environmental Services Department or the Risk Management Department. So let's test your recall. Applying a germicide to a piece of reusable equipment or room surface requires that the germicide come into contact with the entire surface for a specified period of time. This time is called contact time. To ensure appropriate contact time, the surface must be physically exposed to the germicide. Wiping of the surface helps make sure the entire surface comes into contact with the germicide. There is a particular technique that is used to wipe a surface with a germicide. Should you use a circular or back and forth motion to provide overlap to ensure complete contact with the surface? Or should you use a back and forth motion, taking care to avoid going over the same area or areas so inadvertent recontamination of an area is prevented? Use a back and forth method so you can wipe the area applying the germicide and do not go back over that same area. Watch what you are doing so you wipe and apply the germicide to the complete surface. Let's watch this video showing several different ways individuals may have cleaned and disinfected a surface. Now that you have watched the video, what did you notice regarding the wiping of a surface? What would you have done differently now that you have new knowledge about germicides and how they work? What questions do you have about the disinfectant wipe? How did you determine how many wipes to use to disinfect that surface? In the video, you can see the impact of a wipe without friction. The fluorescent marker is still visible. An incomplete wipe, where the fluorescent marker is untouched, and a surface that has been appropriately disinfected using manual friction in new ways that completely expose the entire surface to the disinfectant through a methodical approach to wiping. The fluorescent marker has been removed in this example. A single wipe may not be able to provide enough of the liquid germicide to the surface if the wipe has been allowed to dry or if the surface area is too large. If you can see that there is wetness on the surface, you can tell if there has been exposure to all areas of the surface. If there is a limited amount of wetness and the surface dries immediately, the wipe may not have been wet enough or the surface area was too large to be properly disinfected with that single wipe. There is no single formula for how many wipes are needed for a given surface. The approach is to wet the surface entirely with enough germicide so it continues to have contact with the item while it dries. Leave the area undisturbed for the contact time. Our last simulation helps take what we have learned about disinfection and applies it to the items you may commonly use in your healthcare setting. The next slide will have a chart for you to complete. You will have the piece of reusable medical equipment listed, and you will select which level of risk, according to the Spalding classification, applies to that item: non-critical, semi-critical, or critical. You will then assign the appropriate germicide level, low or intermediate level, high level, or sterilization for that item. Here is our chart. Take a look at the list of items down the left-hand column. Think about what the item is used for and what type of patient contact occur. Remember, items used for non-critical activities come into contact with intact skin. Semi-critical activities allow items to come into contact with mucous membranes, and critical activities allow items to come in contact with sterile body sites and sterile tissue. The next slide shows the answers and the rationale. Here is our chart with the answers. Let's take each row and review. Patient bed rails come in contact with intact skin, so low or intermediate level disinfection is appropriate. Glucose meters come in contact with intact skin, so low or intermediate disinfection is appropriate. Remember, nothing on the meter should be touching the area where the patient's finger has been stuck for blood sugar monitoring. Residents' wheelchairs come in contact with intact skin, so low or intermediate level disinfection is appropriate. If the wheelchair comes into contact with stool and the patient has C. difficile, then a sporicidal agent should be used to clean and disinfect. A laryngoscope blade comes into contact with the mucous membranes of the throat and should be handled as semi-critical, and high-level disinfection should be used. An ultrasound probe used to check pulses on intact skin should be cleaned, then disinfected with a low or intermediate level disinfectant. A vaginal ultrasound probe comes into contact with mucous membranes and should be high-level disinfected. A bedside commode comes into contact with intact skin, so low or intermediate level disinfection is appropriate. However, if that patient was in isolation for C. difficile, a sporicide should be used. An IV pole comes in contact with intact skin, primarily of the healthcare worker, so low or intermediate level disinfection is appropriate. If contamination with a bloodborne pathogen occurs, an intermediate level disinfectant capable of killing those germs should be used. An electronic thermometer comes into contact with intact skin, so low or intermediate level disinfection is appropriate. The probe that enters the patient's mouth should be covered with a disposable cover, and the probe itself should also be disinfected if using from patient to patient. Stethoscopes used in an isolation room should come into contact with intact skin, so low or intermediate level disinfection is appropriate. Stethoscopes used in a non-isolation room should come into contact with intact skin, so low or intermediate level disinfection is appropriate. A stethoscope used in an isolation environment should also come into contact with intact skin and can be disinfected using a low or intermediate level disinfectant, as the hospital-grade disinfectants are designed to address the pathogens often seen in healthcare settings. However, items used in isolation environments are often disposable. If items are deemed as single-patient use, they should be discarded and not reused, even if they are disinfected. During this learning activity, we have talked about the need to ensure that reusable medical devices and equipment are cleaned and disinfected properly so they are not able to be part of pathogen transmission. Points to remember include environmental cleaning of reusable medical equipment is a patient safety responsibility of healthcare personnel, as germs may contaminate equipment and serve as a vehicle of transmission to other patients. Equipment should be cleaned and disinfected between patients using an appropriate hospital-grade disinfectant, as these germicides are selected to best address the types of organisms identified in healthcare settings. The Spalding classification should be used as a guide for determining how to disinfect equipment, thereby enabling consistent and standardized approaches. Disinfectants should be used according to manufacturer instructions to ensure appropriate dilution, contact time, and use. Contact time helps ensure that germs are exposed to appropriate disinfectants for adequate time to kill and ultimately reduce transmission risk to patients and to other healthcare personnel. Thank you for the opportunity to talk about the importance of cleaning and disinfection of reusable medical devices and equipment.
All right. So I hope you learned a few things here. I thought it was really a good presentation. Be sure to go to the website, and there'll be a little button that says that you click it in order to get your contact hours. It's going to take you over to their website. You'll have to go and fill out a few questionnaires. There's a pre-test and then a post-test, and then you get your certificate. Couldn't be easier. One contact hour for free. How can you beat that? So I hope you enjoyed that episode. We'll be bringing more of those to you in the future. And here's what's going to be happening next week.
Gina Powley, MSN, will present Hollister's product line, focusing on cutting-edge advancements in urologic care that enhance patient quality of life. Her session will highlight emerging technologies, best practices, and evidence-based solutions designed to optimize clinical outcomes and streamline patient management. Don't miss this opportunity to gain valuable insights from a leading expert in the field. Join us next week, April 19th at 9 a.m. Central Time to learn more at UroNurse.com.
Yeah, so join us next week. We'll be back to our normal format. You'll be able to ask questions. We'll have our experts. And Gina Powley's a good friend of mine. She's been involved in SUNA for almost as long as I have, I think. Anyway, she's working in industry now for the Hollister company. They got a great line of catheters, and she's asked to come on the show and kind of inform us on what they've got to offer. So join us next week. Meantime, have a great rest of your weekend. Enjoy it, and we'll see you next week.